The purpose of bloodborne pathogens training is to ensure that University of Chicago employees who have an occupational risk of exposure to blood and other potentially infectious materials are provided information about bloodborne pathogens and appropriate protective measures. This program is mandatory and required annually for all employees with this exposure risk. For the purposes of this training, blood is defined as human blood components, and products made from human blood. Other potentially infectious materials, or OPIM, means human body fluids, unfixed tissues or organs other than intact skin from a human, living or dead. The objectives that will be covered during this training session include the regulatory requirements for bloodborne pathogens as mandated by the Occupational Safety and Health Administration, the university's exposure control plan, including responsibilities of university personnel to meet OSHA's requirements, examples of bloodborne pathogens and their diseases, including the two primary pathogens discussed at length in OSHA's standard, exposure determination based on job classification, methods of compliance to prevent contact with blood or other potentially infectious materials, actions to take in the event of a spill, personal protective equipment including proper use and disposal, information on the hepatitis B vaccine, the procedure following an exposure incident, and labeling and signage requirements. In 1991, the Occupational Safety and Health Administration, better known as OSHA, mandated a standard known as the Bloodborne Pathogen Standard 1910.1030 to protect workers from the risk of occupational exposure to bloodborne pathogens. In 2001, in response to the Needle Stick Safety and Prevention Act, OSHA revised its bloodborne pathogen standard to its current version. An accessible copy of the full regulatory text is available on OSHA's website, www.osha.gov, under 1910.1030. The standard requires the employer to implement an exposure control plan. The University Exposure Control Plan is located on the Safety Office's website at safety.uchicago.edu. OSHA requires that an exposure determination be made based on the definition of occupational exposure. The determination is made by reviewing job classifications in the work environment and listing exposures in two groups. The University of Chicago's exposure determination is shown below and can be found by clicking on reference material. In Group 1, all employees with a Group 1 job classification are found to have occupational exposure. Examples of Group 1 job classifications are blood bank technicians, nurses, police officers, and surgeons. In Group 2, some employees with a given job classification may have exposure, but it is task dependent. Only while performing certain tasks does the exposure exist. Examples of Group 2 job classifications are athletic trainers and building engineers. For instance, an athletic trainer may only have occupational exposure to bloodborne pathogens while administering first aid or other medical treatment, but not while performing other tasks. The Exposure Control Plan is a critical provision of the Bloodborne Pathogen Standard. It requires an employer to identify at-risk employees and provide them with adequate training, personal protective equipment, the hepatitis B vaccination, and other precautions. The Exposure Control Plan must be reviewed annually and updated as needed. Under the Exposure Control Plan, various university departments have specific duties in order to meet the requirement of OSHA standard. The Environmental Health and Safety Office has the primary responsibility for the implementation and enforcement of the Bloodborne Pathogen Exposure Control Plan and is responsible for reviewing and revising the Bloodborne Pathogen Exposure Control Plan on an annual basis, providing bloodborne pathogen training for affected university employees, ensuring compliance with the Exposure Control Plan, identifying appropriate personal protective equipment, PPE, and maintaining training records for 3 years from the date on which the training occurred. Departments with employees who have occupations affected by this standard are responsible for ensuring employees complete bloodborne pathogens training annually, providing department-specific training as necessary, providing personal protective equipment to its employees. Employees affected by the Bloodborne Pathogen standard are responsible for complying with the provisions of the university's exposure control plan, participating in all provided trainings, understanding which tasks required by his or her job have the risk for exposure, and using and disposing of personal protective equipment in a safe manner. The University of Chicago Occupational Medicine, UCOM, must maintain a written record of any SHARPS exposures, known as a SHARPS injury log. Lastly, University of Chicago Occupational Medicine, UCOM, must maintain records of each employee with occupational exposure. With the help of all affected departments, the university can continue to meet the requirements of the Bloodborne Pathogen standard. OSHA estimates that 5.6 million workers are at risk of occupational exposure to bloodborne pathogens. Bloodborne pathogens are pathogenic microscopic organisms present in human blood and have the potential to cause disease in humans. Hepatitis B is a virus, which we will be examining in more detail in this module. Hepatitis C is a virus, causing a contagious liver disease. Hepatitis A, B, and C are 3 different viruses, each affecting the liver differently. Symptoms of all 3 are similar, including fever, fatigue, nausea, vomiting, dark urine, and abdominal pain. Only 20 to 30% of people with hepatitis C will show symptoms. Lastly, human immunodeficiency virus, HIV, is another bloodborne pathogen, which will be discussed in more detail later in this module. Of the bloodborne pathogens, hepatitis B and HIV are the 2 most common in the workplace. Parenteral is a mode of transmission whereby direct inoculation of the skin occurs. If the skin is punctured by a needle stick or other sharp object contaminated with blood or other potentially infectious material, OPIM, the virus can be transmitted. This is a most likely mode of transmission. Mucous membrane can be a route of transmission if contaminated material is splashed into the eyes, nose, or mouth. Direct contact may occur between broken skin and body fluids infected with HBV. Sharing needles and syringes. Sexual contact with an HBV-infected person is another route of transmission. Prenatal, when the virus is transferred from the mother to child in utero. And lastly, from transplants and transfusions. Hepatitis is a general term that means inflammation of the liver. The hepatitis B virus infects the liver by causing inflammation. Symptoms can range in severity from a mild illness lasting a few weeks to a serious lifelong illness. Hepatitis B can also lead to more serious conditions such as cirrhosis of the liver, a condition marked by an increase in fibrosis tissues with a hardening caused by excessive formation of the connective tissue followed by contraction. Hepatitis B can also lead to liver cancer and even death. The chart shown, created by the Center for Disease Control, CDC, shows the incidence of acute hepatitis B in the United States. The green dashed line on top shows estimated cases. This is because many cases of hepatitis B are without symptoms and go unreported. Both lines show a decrease in incidence of the disease, particularly around 1991, when the routine vaccination of children was first recommended. In 2015, there were an estimated 14,416 new hepatitis B virus infections in the United States. Approximately 1,700 people die annually from hepatitis B-related illnesses. Fortunately, the number of occupational infections has decreased 95% since the hepatitis B vaccine first became available in 1982, from greater than 10,000 cases in 1983. Up to half of all hepatitis B cases are asymptomatic, and many cases do not get reported. Common symptoms that are experienced include fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, and jaundice, the yellowing of the eyes, and other mucous membranes. According to the CDC, approximately 95% of adults recover from hepatitis B, known as acute infection. 5% will remain chronically infected for the duration of their lifetime. Chronic carriers are at an increased risk for cirrhosis of the liver and hepatocellular carcinoma, a serious liver cancer. Hepatitis B symptoms begin ranging from 60 to 150 days after exposure, with the average being 90 days. If you have a workplace injury and wish to determine if you have become infected with hepatitis B, blood testing may be performed. Your blood will be examined for the presence of hepatitis B. The blood marker used in diagnosis, known as the hepatitis B surface antigen, can be detected in high levels during acute or chronic hepatitis B infection. The marker will be detected in an infected person's blood in an average of 4 weeks after exposure, but can range from 1 to 9 weeks. It is important to know how hepatitis B is transmitted so that workers can adequately protect themselves from exposure. The vehicles for hepatitis B transmission include blood, blood-derived body fluids, saliva, semen, urine, and feces. Parenteral is a mode of transmission whereby direct inoculation of the skin occurs. If the skin is punctured by needle stick or other sharp object contaminated with HBV, the virus can be transmitted. This is the most likely mode of transmission. Mucous membrane can also be a route of transmission if contaminated material is splashed into the eyes, nose, or mouth. Direct contact may occur between broken skin and body fluids infected with HBV. Sexual contact with an HBV-infected person is another route of transmission. And lastly, prenatal, where the virus is transferred from mother to child in utero. Saliva and semen may contain the virus, but at a 1,000-fold lower concentration than blood. Hepatitis B is not spread through food, water, sharing eating utensils, breastfeeding, hugging, kissing, hand-holding, coughing, or sneezing. Hepatitis B virus is capable of surviving in dried blood for up to 7 days. It does not need a host for survival. This is why other protection methods, such as personal protective equipment, are so critical. Human immunodeficiency virus, HIV, causes the fatal disease acquired immunodeficiency syndrome, or AIDS. HIV is different than other viruses because it attacks the body's immune system. The virus works by finding and destroying white blood cells, which is the body's natural defense against disease. HIV progressively destroys the body's ability to fight off infections and certain cancers. The CDC estimates that 55,000 people are infected with HIV each year, and an estimated 1 million people in the United States are living with HIV or AIDS. Many people infected with HIV do not show any symptoms for 10 years or more. The following may be warning signs of advanced HIV infection: rapid weight loss, dry cough, fever, profound and unexplained fatigue, swollen lymph glands, certain pneumonias, pneumocystis carinii, and a form of cancer, Kaposi sarcoma, that produces purple blotches on the skin. However, no one should assume they are infected if they have any of these symptoms. The only way to determine if a person is infected is to be tested. You cannot rely on symptoms alone. A blood test will look for the presence of specific antibodies. However, keep in mind it can take the immune system time to develop enough antibodies for the test to detect them. Most people will develop detectable antibodies within 2 to 8 weeks of exposure. In very rare cases, it can take up to 6 months to develop the antibodies. The modes of transmission of HIV are similar to those of hepatitis B. HIV is primarily found in blood, semen, or vaginal fluid. HIV can be spread via direct inoculation of the skin or parenteral. HIV can also be transmitted through mucous membranes if there is an exposure to HIV-contaminated material. Other transmission modes include direct contact between broken skin and body fluids infected with HIV, sexual contact, sharing needles with an HIV-infected person, contact with semen through artificial insemination, and prenatal, where the virus passes from the mother to child in utero. Lastly, HIV may be transmitted by receiving transplants of HIV-infected blood, organs, or tissues. However, since 1985, all donated blood has been screened for HIV, so the likelihood is extremely low. There is no evidence that HIV can be spread through sweat, tears, urine, feces, or casual contact such as doorknobs, toilet seats, or drinking fountains. Now that we understand the viruses which pose a risk, we will take a look at the ways to protect ourselves. There are 4 main categories of compliance methods: universal precautions, engineering controls, work practices, and housekeeping. Universal precautions is a method of compliance whereby all body fluids are presumed to be infectious. This is critical in situations where it is difficult to distinguish between fluids. For instance, police officers responding to a scene at night may be unable to differentiate between blood and other fluids in the area. By presuming unknown materials are known to be infectious, employees can take the maximum precaution to protect themselves. Engineering controls reduce the risk of exposure by either isolating the worker from the exposure or removing the hazard altogether. Engineering controls need to be examined and maintained or replaced on a regular basis to ensure their effectiveness. Hand washing facilities are a good example of an engineering control. Be sure there are adequate paper towels and soap at the hand washing facility in your work area. Work practices is a term used to describe the manner in which the job is being performed. The risk of exposure can be reduced by the use of safe work practices. For example, 1. Wear gloves whenever handling body fluids. 2. Properly handle and dispose of contaminated items. This could include sharps, bandages, gauze, linens, or cleaning materials. 3. Be sure to place used sharps in their designated containers promptly after using them. 4. Take care to minimize splashing, spraying, or spattering of blood or other potentially infectious materials. 5. If you're not already, get in the habit of regular hand washing throughout your daily tasks, even if you've been wearing gloves. 6. Wash hands or any other areas immediately if there has been any kind of skin contact. 7. Similarly, make use of the emergency eye wash or safety shower immediately after an exposure to the eyes or other part of the body. Protective coverings must be removed at the end of the work shift or whenever they have become overtly contaminated during the shift. Any bins, pails, or other receptacles that are reused must be decontaminated on a regular schedule or whenever there is visible contamination. When cleaning up broken glassware, make sure to use the aid of a mechanical device such as a dustpan and hand broom, rather than reaching for anything with your hands. It may be tempting to grab the larger pieces of glass by hand, but this puts you at an increase for an exposure. Housekeeping is the 4th category of protection against an exposure. All workspaces should be maintained in a clean and sanitary condition. Each workplace should have a written schedule for cleaning and disinfecting. Be sure to include all equipment and working surfaces in the written procedures. There are 3 key instances when you should decontaminate: when working surfaces are overtly contaminated, after a spill of blood or other potentially infectious materials, and at the end of a work shift, if the surface may have become contaminated since the last cleaning. A common disinfectant used is a solution of household bleach made up of 1 part bleach and 10 parts water. This is approximately 2 cups of bleach in 1 gallon of water. When applying the disinfectant, try to minimize any splashing or spraying. Allow for a contact time of 30 minutes. As an alternative to a bleach water solution, the Environmental Protection Agency, EPA, maintains a list of EPA-registered antimicrobial products effective against certain bloodborne pathogens. Registered products effective against HIV and hepatitis B can be found at epa.gov under List D. The last portion of training pertains to communication of hazards to employees. Warning labels are required to indicate any containers which contain biohazardous material. Examples include shipping containers, refrigerators, freezers, and sharps containers. Labels must display the biohazard symbol, be fluorescent orange or red, with letters and symbols in contrasting color to the background. The labels shall be affixed as close as possible to the container so as not to be removed. OSHA allows for red bags or red containers to be substituted for labels. Signs are required to be posted at the entrances to any work areas of HIV and hepatitis B research laboratories and production facilities. The sign must contain the name of the infectious agent, special entry requirements, the name and phone number of the responsible person, and the biohazard symbol. As with labels, the signs must be fluorescent orange or red, with letters and symbols in a contrasting color to the background. As mentioned at the beginning of the presentation, this training is not meant for employees or students working in research, teaching, or clinical labs. The Office of Research Safety manages the BBP Exposure Control Plan and signage for laboratory activities. With regards to waste disposal, be sure to adhere to the color-coded waste bag system. General waste goes into the black bags for the campus. For any potentially infectious waste, a red bag shall be used. Be sure to empty all waste containers regularly so they are not overflowing. For disposal of employees' personal sharps, for example, syringes, insert them into an empty detergent or soda bottle and label "Sharps, do not recycle," then dispose of them in the general waste. All other potentially infectious waste, for example non-sharps, bandages, or blood-soaked materials, can be thrown directly into the general refuse and do not require the use of a red biohazard waste disposal bag. For waste disposal in non-laboratory buildings, place syringes and potentially contaminated sharps inside a red sharps container. Waste containers for BBP must be disposed of via the university's term waste vendor. Contact EHS for information on how to set up an account for your location or to arrange for a potentially infectious waste pickup. Let's take a closer look at the types of infectious waste you may have. Red bag regulated waste is also known as infectious, biohazardous, or medical waste. Red bag waste can include human pathological waste, human blood, blood products, and animal waste. As long as there is nothing sharp in this waste, it must go into a leak-proof, closable red plastic container lined with a red bag. All sharps should be placed directly into puncture-resistant sharps containers. For red bag waste, leave at least 6 inches of room at the top of the container. This will allow for proper tie-off of the bag. Overfilling a sharps container is a danger to other users that may try to add sharps to the container and also creates a hazard for the vendor scheduled to pick up the sharps containers. It is important to know the actions to take in the event of a spill of blood or OPIM. All spills shall be immediately contained and cleaned up by employees properly trained and equipped to work with potentially infectious materials. In certain situations, you should call for outside help immediately. This includes if there is a spill of an unknown agent, a spill of a substance which poses an inhalation hazard, or a spill of a quantity greater than 1 liter. In these cases, evacuate the area immediately and notify the appropriate group that assistance is required. If you are located on the campus side, call UCPD at 773-702-8181 or 123 from any campus phone. In all other cases, you may clean up the spill yourself, adhering to the following procedures. First, warn people in the immediate area about the potentially infectious material spill so that no one inadvertently comes into contact with it. Then, gather all necessary spill response supplies, including plastic liners, reusable containers, sharps containers, a fresh bleach solution of 1 part bleach to 10 parts water, paper towels, broom, dustpan, and personal protective equipment. Next, put on your personal protective equipment, or PPE, to prevent exposure to mucous membranes while cleaning up the spill. Now you're ready to enter the contaminated area and proceed to pour or spray the disinfecting bleach solution in a circle around the spill to contain it. Then you may apply the disinfecting bleach solution directly over top of it. Cover the spill with paper towels and allow for a contact time of at least 30 minutes. After 30 minutes, clean up all materials and place into a designated red bag labeled as biohazard waste. Remember to handle any broken glass or other sharp objects with a dustpan or tongs, never with your bare hands. All PPE that was used in a spill cleanup should also be disposed of as biohazard waste. Take care when removing the PPE to avoid contamination by folding the contaminated areas inward. Close all plastic liners and containers. Be sure to wash all body parts including hands, arms, and face immediately following the cleanup. Notify your supervisor or facility manager of the spill and arrange for pickup of biohazardous waste. The next section of the training pertains to personal protective equipment, or PPE. It is OSHA's policy that, when there is still a risk of occupational exposure after engineering controls and work practices are in place, PPE shall be used. PPE is used to provide a physical barrier between you and the potentially infectious material. PPE must be used in all occupational situations where there is a potential for the employee to come in contact with potentially infectious materials. There are general rules that apply to all PPE. Employees must be properly trained on its use. The equipment must be appropriate and suitable for the task. It is the university's responsibility as the employer to provide PPE and replace it when it becomes damaged. Employees should not have to pay for PPE out of pocket. Lastly, employees must remove and replace any damaged PPE immediately after a penetration or contamination. Now, we'll take a look at more specific types of PPE. A critical part of PPE are your gloves. Gloves must be worn whenever there is an anticipated risk of contact with blood or other potentially infectious materials. Common glove materials include latex, nitrile, and rubber. There are a variety of hypoallergenic gloves, powder or powder-free gloves, and glove liners for employees who have certain allergies or sensitivities. Regardless of the type of glove, remember to bandage any open cuts or sores before putting on gloves, since gloves can be penetrated by sharps or have microscopic holes unseen by the naked eye. Tasks performed by janitorial staff will likely use a disposable or single-use glove. Be sure to replace these as soon as they become contaminated or punctured. Discard and do not reuse. More heavy-duty tasks will require a utility glove, which may be decontaminated and reused. Soak the gloves in a bleach and water solution for at least 10 minutes. Do not attempt to reuse utility gloves if they are cracked, torn, or otherwise damaged. It is up to all employees to prevent cross-contamination. Contamination can spread by touching door handles, phones, or elevator buttons with a gloved hand. Place signage in your workplace reminding all employees to remove gloves before exiting. When removing soiled gloves, never touch the outside of the gloves with bare skin and always wash your hands immediately following removal. There are two common methods for removing gloves so as not to spread contamination. In option 1, the first glove is completely removed. Use the other gloved hand, pinch at the wrist, and remove from the bottom. Ball up the removed glove in the other hand. Next, insert a finger of the exposed hand under the glove and roll it off your hand inside out so the first glove is inside the second. Dispose of the gloves and wash your hands. In option 2, partially remove the first glove only halfway. With the partially gloved hand, pinch at the wrist of the gloved hand and pull inside out and remove entirely. With the exposed hand, pinch the half glove hand, being careful to only touch the inner portion. Discard the gloves and wash your hands. It is important to wash your hands following removal of any type of glove, disposable or utility. Hand washing offers protection against accidental exposure that may have occurred during glove removal or due to unseen holes or penetrations in the gloves. Eye protection shall be worn anytime there is a reasonable risk of generating splashes, sprays, spatters, or droplets. Goggles form a tight seal to the face, while glasses do not. In addition to cleaning up spills, PPE may be required for first aid CPR response. Respiratory devices are another type of PPE. These devices, such as microshields or pocket masks, can protect an individual who is administering resuscitation from the victim's saliva. Always remember to dispose of all PPE prior to leaving your work area in order to prevent any cross-contamination. Carefully remove PPE, taking care to keep the contaminated side contained by folding or rolling inward. Place your PPE in the designated container for storage, washing, decontamination, or disposal as appropriate. Make sure your containers are properly labeled, color-coded, and leak-proof. Soiled laundry that will be disinfected and reused should be placed and transported in leak-proof bags or containers marked biohazard. Labels shall be fluorescent orange or orange-red, or predominantly so, with lettering and symbols in a contrasting color. As a University of Chicago employee with the potential to come into contact with bloodborne pathogens, you are entitled to a free vaccination against the hepatitis B virus. The vaccine has been shown to be highly effective. In fact, the reported incidence has dropped 75% since 1991, when the vaccine was first routinely offered. The vaccine is a series of 3 injections to the arm. There is an initial shot, followed by a second shot 1 month later, and a third shot 5 months following the second, 6 months from the initial. To ensure immunity, you must complete the series of 3 injections. The vaccine causes no harm to those who are already immune, or to those who may be HBV carriers. Although employees may opt to have their blood tested for antibodies to determine the need for the vaccine, such screening is not a condition of receiving the vaccine, and the university does not provide this pre-screening. Each employee will receive counseling from a healthcare professional when the vaccine is offered. This discussion is to help an employee determine whether inoculation is necessary. Employees may decline to receive the vaccine. A declination statement must be signed. At any time after an employee declines, he or she may opt to receive it at no charge. The United States Public Health Services does not currently recommend booster doses of the vaccine for people with normal immune systems. Therefore, they are not necessary at this time. If a booster dose is recommended in the future, employees will have the opportunity to receive it again at no cost. Booster doses are recommended for hemodialysis patients or other individuals with weakened immune systems. You have the option to receive or decline the vaccine. Complete and sign the Hepatitis B vaccine acceptance or declination form located in the reference materials section. Instructions for submittal are included on the form. An exposure event is defined as any contact, including eyes, mouth, broken skin, or parenteral, with blood or other potentially infectious materials that may result from an employee performing his or her duties. If you have an exposure incident, the first step is to flush the affected area for 15 to 20 minutes. Go to the nearest eye wash, safety shower, or sink, whichever is appropriate based on where on the body the incident has occurred. After flushing the area, make sure your supervisor has been informed of the incident and seek medical treatment within 1 hour. Reporting the injury or incident right away is important because it allows you to be treated as soon as possible, can prevent the spread of bloodborne pathogens to others, and will allow for an evaluation of the circumstances surrounding the incident to try to find ways to prevent it from happening again. A medical evaluation and treatment shall be made at no cost to employees who experience an exposure incident. Specific to a bloodborne pathogen exposure, the evaluation will document the incident, including the route of exposure and how it happened. It will also identify the source individual whenever possible. The blood of the source individual should be tested after consent is received. Results of the blood test shall be shared with the individual who has been exposed. The exposed individual's blood will also be tested, again after consent. The exposed employee may decline HIV testing if he or she wishes, and the blood sample will be maintained for 90 days. If, within 90 days, the employee changes his or her mind, HIV testing may be performed. The employee is also entitled to post-exposure counseling and treatment. The university is required to obtain and provide to the employee a copy of the healthcare professional's written medical opinion within 15 days of its completion. The written opinion will be limited to the following: whether hepatitis B vaccination is indicated, and whether the employee received the vaccine. It will also include a statement that the employee has been informed of the results of the evaluation and any medical conditions resulting from the exposure. Note that it will not indicate what the results were, only that the employee has been informed of them. All other findings must remain confidential. The university is required to keep any medical records for the duration of the employment of the individual plus 30 years. All accidents and incidents should be reported via the University of Chicago Accident and Incident Reporting Tool known as UCARE. An accident is an unanticipated or off-normal event that results in injury, illness, environmental release or impact, or significant property damage. If an accident occurs at work, follow this procedure to ensure the appropriate groups are notified. If it is a serious injury or an emergency on campus, such as a fire or environmental release of a chemical or oil, dial 123 from a campus phone or 773-702-8181 from a non-campus phone. UCPD dispatch will not send the Chicago Fire Department, CFD, or an ambulance unless it's requested. However, the CFD will respond if a fire alarm has been activated. Please note, if you are located in an off-campus facility, such as the Gleacher Center or Ricketts Laboratory, please call 911 in the event of an emergency situation that requires an ambulance or the fire department. Then, contact 773-702-8181 to inform UCPD. Some emergencies, such as fatalities, injuries requiring medical attention, or an oil or chemical spill that enters a drain, require notification to various regulatory agencies within a specific window of time after an accident occurs. Therefore, it is critical to immediately notify UCPD so the appropriate safety office can be paged and begin the response process. Once you have notified UCPD of the emergency, you may then proceed to enter a summary of the incident via the UCARE reporting tool. Please note, submitting a UCARE form by itself will not initiate response procedures. After you've notified UCPD for an emergency situation, notify your supervisor and submit the UCARE form by going to the UCARE website. If the accident resulted in an injury, you and your supervisor will also complete HR forms, detailed later in this presentation. In addition to reporting accidents, the intent of the UCARE system is to ensure incidents are also reported. An incident is a close call or near miss that has the potential to escalate to accident status. We can proactively eliminate future injuries and other preventable accidents if you report incidents that occur on campus. The UCARE website can be found at ucare.uchicago.edu. On the UCARE website, you will find links to download the UCARE mobile application to Android and Apple iOS devices, such as smartphones and tablets. To submit a UCARE form, on the website, click on the envelope icon found in the center of the page. The UCARE form is simple and self-guiding. Please provide as much information as possible. You can also attach photos or documents to the UCARE form. If medical attention is needed, then the form will have certain fields tagged as required. If the medical attention button is not selected, then you are not required to enter your name or contact information. This allows you to report unsafe conditions anonymously. If you were injured, you and your supervisor will complete the following forms provided by the Human Resources Benefits Office. Leave administration. The first form is the WC Form 100 Request for Evaluation and Treatment, Work-Related Illness or Injury. Please note the WC Form 100 is only required if the employee is going to the University of Chicago Occupational Medicine Clinic, UCOM, for a non-emergency work-related injury during normal working hours. The next form is the Supervisor's First Report Workers' Compensation Claim of Injury Illness form, which is filled out by the supervisor of the injured employee. The last form is the Employee's Statement of Injury or Illness Workers' Compensation, which should be completed by the injured employee when able to do so. For more information regarding these forms, contact Human Resources, Leave Administration. Please note, UCOM is open Monday through Friday, 7:15 a.m. to 4:30 p.m. While the Adult Emergency Department entrance, located at the southeast corner of 57th and Maryland Avenue, is open 24 hours. If you have any questions or concerns regarding any of the content of this training, please contact Environmental Health and Safety at 773-702-9999 or email at safety@uchicago.edu. Thank you for completing the Bloodborne Pathogens training. Proceed to the Vaccine Status link by clicking Vaccine Status and complete the quiz with 70% or better to receive credit for this course. Thank you.